Okay, so we're recording now and I'll share my screen again. Just 1 second.
So do you guys want to run through and tell me your programs one more time? I know we did it through email, but okay.
That's fine. So I'm Courtney Withers and mine is social work, the master's program.
I'm in the nursing program at UE.
I'm a pharmacy student at Butler University.
In the DPT program at UE.
Okay, hold on. I didn't type fast enough. So Martin you're in what?
The DPT program, physical therapy.
Okay. At UE.
Yes.
And then who did I miss? Lily?
Yeah. I'm a pharmacy student at Butler.
Okay. Okay, got it.
Okay, so as far as the first task, it looks like just discussing the elevator speeches that we did. So the first prompt, how difficult was it for you to develop your elevator speech?
I would say for me, it was tough to get it down to 30 seconds for sure.
Yeah, that was my challenge too.
It's kind of and I feel like with all of our professions, it's hard to narrow it down just to that, and especially with the 4 questions too. Like, oh no, what do I focus on?
Okay. And I know with mine being social work, it can be really broad depending on like what population you're working with. So trying to just make it a very general description in a very short period.
Yeah, and for me too, it was the misconceptions were kind of like stereotypes. So like I wanted to kind of like talk about that more. And I felt like same with all of you guys, just the 30 seconds wasn't enough to do it because there are a lot of like misconceptions of roles, especially in healthcare and on a team.
All right. So then the next one is just talking about 2 misconceptions that were shared among our group, and then what about these misconceptions was most surprising to you? I guess on that one we would just talk about like the misconceptions of other people's professions that was surprising. So I think like with the pharmacy one, Lily, with yours, I had recently about 7 months ago switched to a social work position at Union Hospital in Terre Haute, and so I work on a team that includes pharmacy, and I honestly didn't realize like what all pharmacists did. I didn't think that everybody just worked behind a retail counter like you had said, but I didn't realize how involved they were in patient care and how broad the roles were. So
Yeah, absolutely. I don't think a lot of people know that, and I think it's something that's been advanced in recent years for sure. I think pharmacists are kind of getting more and more involved.
anyone else?
Does someone just want to like recap their misconceptions in case if someone forgot something like that?
That might be easier. So mine was social work, and I had said basically, I think the biggest misconception that I've experienced is that it almost seems like when the word social worker comes out of my mouth, you get kind of like like I think people think it's something bad if a social worker is calling them or involved, or that something is majorly wrong or something like that. And I try to explain a lot that it doesn't necessarily mean something that you're doing something wrong or something's bad. We're just kind of an additional support that can help link you to whatever the appropriate resources are that you need, and kind of work with them to engage through that little bit of uncertainty, I guess. And also, I think when I tell a lot of people what I do and I say social work, they immediately think child welfare and removing kids, which obviously, some of it can include that, but there's so many different fields of social work, like healthcare and school and so on.
Martin, do you want to share your misconception?
Yeah, so what I mentioned in my video was that patient needs a referral in order to see a PT. And actually, I kind of shocked her too, because I didn't realize that until I did some research and learned about it. And it's pretty interesting, I would say.
So like someone can call an agency that provides PT services and just request to start. Is that what you're saying?
I guess they can feel free to walk in or make an appointment at a clinic or stuff like that to, I guess, you don't have to talk to your primary care physician in order to start the arrangement, I would say.
I didn't know that. I would have assumed you had to go through someone else to get started.
Yeah, me too. That's what it was. I think it's like someone like the hospitals that are connected. I think they might require a referral because when I threw out my back, I had to get a referral, and they wouldn't take me without going to my physician first. But that's really interesting, actually. My misconception was that a lot of times people think that like the doctor is like the most important person on the healthcare team, or is like the leader, like the person who knows the most. And I feel like that was a misconception because that role is not even you can't. I said like healthcare is a tag team sport, so it's definitely like you have to get everyone in it together. Not one person can do the job entirely, especially if you want to provide like a well-rounded patient care experience. So I think a lot of times that is a misconception that like the doctors are the most important. And yeah, I don't know if anyone knows anything to say that.
So my misconception for nursing was that like people don't really realize the different professions you can actually do in nursing, because usually whenever you think of nurse, you just think of like clinical care, like someone who's actually with the patient all the time doing stuff like that. But I didn't realize until I looked into an internship this summer at the hospital, there's actually a nurse who will like go out and recruit students to start in an internship and stuff like that. Like she's working at a desk most of the time, and I just didn't realize like nurses even worked at desk, honestly. So
I actually had the same misconception early on. I didn't know like the full extent of what nursing was, and when I looked into it, I definitely like found out that even I think it was like you can change like where you work or like the field that you work in quite like easily. So I mean that's really awesome in terms of like flexibility and hours and
yeah.
interest stuff like that. Yeah.
So my misconception, as Courtney mentioned, was that I think a lot of people, when they first think of pharmacists, is that it's somebody behind like a retail counter, which is a very respectable and awesome position for pharmacists to be in because you get close contact with patients and everything. But I think, especially in a hospital setting, not a lot of people know how pharmacists get involved with patients that way.
So, and Kamna, is that how you pronounce your name? I'm sorry.
Yeah. Yeah.
Okay. I'm always afraid to butcher somebody's name. Like
Oh, you're okay.
Do you have all of that for the?
I do, yeah, and I think it says to do like a 100 to 300 word write-up. I can do that. I have all the, yeah.
Okay, I didn't want to like move on too quickly.
No, you're good. I did. I have it.
Okay. So the next part is just kind of reflecting over the John Doe video that we watched individually and discussing as a team and reflecting 200 to 400 words as a team, how we came together to address Mr. Doe's health concerns.
Mm-hmm.
Okay. So
I thought it was, do we have to watch it together again?
yeah, it says on here, let me see. Okay, so The videos on this page were reviewed individually when you developed your individual list of concerns, but can be viewed again during your team huddle as you develop your team concerns. It can be viewed again, because I know there's a do you guys want to watch it together, or do you want to watch? It says we can, but I know the next week we do.
I would like to, because the last time I watched this was like on Monday, so it's just been a time. Yeah.
Okay, no, that's totally fine.
Okay, thanks.
So I'll start it since my screen is shared, and then it would probably work best if everyone else muted themselves so that you're hearing like the feedback. If for some reason you can't hear it, let me know. So.
Okay. I can't hear it. I don't know.
Me neither.
Okay, I'm not sure. Yes, I can hear it. Oops. Okay, let me know now if you can hear it.
Especially when your feet hurt. It's just getting harder, you know? When you start getting old and you start feeling it, you know, your whole body starts telling you you're old. It's just harder to get and do stuff, and especially when your feet hurt. I'll tell you, having sore feet is the worst thing. You know that feeling you get when, like, your feet have gone to sleep and then they start to wake up and you get those really sharp pins and needles, you know, it's ow, kind of thing in your feet. That's how my feet feel all the time now. I mean, think about that, you know? Just walking somewhere is horrible. And of course, it wouldn't be as bad if I could, you know, actually stay on my feet too, but I swear, maybe it's because they hurt or something, or because I'm trying to be easy when I'm walking, but I feel like every time I try to walk just down the block to the convenience store for coffee or something, I fall, and, you know, my knees are so skinned up, it's not funny. Oh my gosh. Just can't keep my balance, you know. And that's about as far as I walk anyway. It's just down to the convenience store, you know. Thank God it's there, or I'd probably be starving because I can't get to a grocery. There's no way. And even if I could, I don't think I could afford anything in it. My God, their prices are ridiculous now. But convenience stores got, you know, cheap donuts, good coffee. So I head down there, and you know, most every morning, and then grab something while I'm there for lunch or dinner later. You know, get some chips or a sandwich or something. Or, you know, they've got frozen, like corn dogs or sandwiches and stuff. Those are, and they're pretty good, you know. And that way I don't have to spend as much, and I can do it all at once. And try to maybe pick up a couple days worth so I don't have to walk every day. Other than that, I'm pretty much right here, you know. I mean, it's not like I'm entertaining people anyway, so what makes a difference? I mean, how I think most of the people I know are dead, or dying, or moved away, you know. I don't know. I don't see anybody anymore. I used to see people at church, you know. I know those people, but I know them by their first name. I know, you know, Don, and there's Sue, Jane. That's all I know them by, you know. I wouldn't know how to contact them or anything. And I haven't been to church in, I don't know, 3-4 months, at least. I just, you know, it's hard to get up on Sunday morning anymore. It's kind of hard to get up any morning. But I get up when I want to. I got my independence, you know, I can do what I want. And I like that. I want to keep that. So, you know, I don't know what I should do. I mean, I'm getting fat and I'm not even eating as much as I used to, but I guess not really moving as much as I used to either. I'm starting to feel like one of those kids you see on TV at 2 a.m., you know, the swollen belly. But I don't know. I know I should exercise, but I can't. You know, my feet hurt so bad that I can't do any kind of cardio or anything like that. And if I can't do the exercise, I can't get better. But you know, I'm kind of stuck in a vice here. So I don't know what to do. And now my jaw is hurting. I don't know if I have a toothache or something. I don't know, but my whole jaw hurts. It hurts to talk. It hurts to eat. So I don't want to eat much. But, you know, and I want to get I thought I'd get the ibuprofen, and I got one of those bottles, and you know how much one of those things costs now? It's ridiculous. I mean, fortunately, they got these little packets of 2, so I can get 2 just to take care of the problem maybe. And maybe if I can get rid of that, then I can start getting rid of the feet too, or, you know, the hurt there. I don't know what to do. What do you think?
Okay, so it looks like now just kind of us each talking about like what our individual concerns were for this gentleman, and then prioritizing them as a team. I can share what I put if you guys are okay with that, and then we can kind of just see if any. I'm sure you guys had different things, but I had put, you know, that my concern for him is that his only, you know, food source is from a gas station, and that he can't get to the grocery store and can't afford groceries, and is resulting in him having a poor diet. That he has limited social supports. He mentioned that they're dead, dying, or have moved away. He did mention church. You know, that sounds like it was a positive support for him, but that he hasn't been there in 3 to 4 months. He talked about it being hard to get up and moving, or get up any morning. So I think there would be some concerns about maybe some depression. He did mention that he valued his independence and wanted to keep that, which isn't necessarily a concern. I just noted, you know, something to keep in mind. And I put that his health issues don't seem to be well addressed, that he's addressing it by taking ibuprofen packs from, I assume, the gas station. He mentioned that his feet and teeth hurt and that he can't ambulate very far.
I definitely agree with everything you said. You pretty much mentioned everything that I hit on. Just from a pharmacist point of view, I would be worried about, you know, affording his medication if that's something that they look into treating him with. But yeah, I also noted that I was worried about his transportation, like ability to get to care, because it sounds like he walks a lot to the gas station and doesn't really drive.
Same as well. And like one additional thing was, I wondered, like, you know, if he's on some kind of like healthcare program or like has some kind of health insurance, or a lot of times like patients just don't know where to get started with, you know, getting health insurance. So maybe that's something that we could look into, is getting him in contact with someone who could help him set up his own health insurance if he doesn't have it.
I hit on pretty well the same like list that you all said, so not really much help.
Martin, did you have anything different, or was it about the same?
I think it's the same, but I think the biggest concern that caught my attention would be his diet. I guess how his diet could lead to his other things like um is I think diet is like that caught my attention, and that really I guess like domino effects afterward, like how his diet affect how everything else, like his walking, other things like that as well.
Okay.
Alright, so I just want to read like what I put down on notes to make sure that I got what you guys were saying properly. I said only I'm gonna write this better eventually, but only food sources from gas station, can't afford groceries, poor diet, low social support, friends are dying and moving away. Church was his support group, but lately he's not been going. He can't move around as well as he used to. Might lead to like or might indicate symptoms of depression. He values his independence and he's really concerned about that, so it's something we should keep in our minds. Ibuprofen is expensive for him and it isn't really addressing his problems. And his teeth and feet hurt and he can't really ambulate. And we're worried about if he can afford medication and transportation and whether or not he has health insurance, as well as like our leading factor of like the diet. So I guess we could just like order those things. Does that sound right? Did I get that right for everyone? Okay.
Okay.
That's good.
I think prioritizing the concerns, I mean, there's several. I think he said in the video that like he knows he needs to exercise and that he needs to do several things, but that his pain in his feet prevent him from doing those things. So I don't know if maybe we can start by like addressing his physical pain, since maybe that's leading to some of the other issues. But I know that I don't think that would be the number one concern, because I mean it is a concern, but I'm thinking like in order for him to address that, he's going to have access to transportation and to healthcare. So maybe like basic needs, basic resources is like the top concern, unless someone feels differently.
Yeah, I think that's really valid, especially because sometimes, like, with medications, we have the means to treat some of those, like, not quick fixes per se, but those things that are treatable. So I think starting off with, I don't know, it's interesting because I don't know if it's like a priority per se, but it's something that could be mediated pretty well with like our resources, just like the foot pain and yeah, and with that, like, we're just like if he had access to like Medicaid, then he'd have like dental care as well. I think we have like a timer. Did you guys see the timer pop up?
Yeah, it says we've got about 10 minutes. So when it gives me a warning that it's about to run out, what I can do is just start another meeting and send you guys the link and then start recording it again.
Okay.
So what do you guys think the first one should it be like the foot pain maybe? I don't know if it's like a priority, but it is something that might be like treatable, if that makes sense.
I think because it seems like that's his number one concern, like that's what he started with. I think that's a good number one concern for us.
Okay. So I'm gonna write medication for foot pain after diagnosis. To see if he needs it, or if he needs like PT or whatever, or something else. Medication therapy.
I think it's jaw pain too, because that seemed to be distressing for him and could be obviously connected to some kind of infection or a number of things.
Right.
I think social support is kind of a big thing, in my opinion, because like if he doesn't have anybody there supporting his decisions to get better or like to motivate him to get better, I don't know like how much he'll actually do to get better, like for himself.
And I think just access to like transportation and health coverage, because if he doesn't have those things, then he's not really going to be able to address the foot pain and jaw pain.
Could I write like Medicaid as third, and then for the social support, maybe bloop that in with maybe like addressing depression in general?
I think that would be okay.
Yeah.
Okay, so we'll write addressing depressive thoughts. Maybe we don't know if he has depression.
Maybe just lack of motivation.
Yeah,
We talked. I was just thinking depression from like it's hard to get up in the morning.
right, right. Social support. I'll put that underneath it or next to it.
I think too, like you talked about not being it. So we've got like his foot pain, his jaw pain, social supports, addressing his lack of motivation, possible depression, health insurance, transportation, and then I think like if he can't afford food, like he could. It sounds like his income is pretty limited, and he lives in kind of a rough area. So assessing to see if he might possibly qualify for like food stamps or some kind of government program to assist him with being able to access food that's not from the gas station.
One thing that Martin brought up was the diet, and I feel like we're kind of a little too far on the list. I think diet should be like after jaw pain, because that's something that like I think would be like talk to this patient in the examination room, like talking about diet and lifestyle, you know? So I don't know what you guys think, but I think it should be, I have right now medication/therapy for foot pain, jaw pain is number 2, and Medicaid is 3, and then 4th is depressive thoughts, like addressing depressive thoughts. I'm thinking the diet might go in after 2. I don't know what you guys are thinking about that.
I think that's good. Yeah.
Yeah, because that could be related to a number of other things that come down on the list. So he has a crappy diet. It might make him tired and sluggish all the time, which could lead to him mentally, like emotionally, just feeling like crap if he physically hurts and is tired and those kind of things. So
I know there's like transport, like buses, they're pretty cheap, but I actually don't know how much like a bus pass is. Actually, I don't know if you guys know in general.
I know, like in Terre Haute, there's the city bus, and if somebody uses it regularly, a monthly pass is cheaper than like a ride by ride. It's like $45 for a monthly pass, which is unlimited rides.
Yeah. Okay. And then we have a third quadrant called reprioritized concerns.
Is that after we watch the next video?
Is it? I think so. Oh, I see. Okay. Yeah. Yeah, you're right. I just looked at that. Thanks for catching that.
So let me know when you guys are ready and I can play the next video.
Courtney, do you want to start like a new?
That would probably be a better idea because it would cut off in the middle of the video.
Right.
So, give me just a minute. What I'll do is I'll stop sharing my screen and I'll start a new meeting, and I'll just send you guys the link, and then we can start it and then kind of go from there.
Okay. Thank you.
Thanks.
No problem.